All right, ladies and gentlemen, my name is Andre Spivey. I'm a security engineer and researcher at SecNet Lab and a system security engineer contracted for AdZero Security and a couple of other companies. One of the things I've been looking at lately is blockchain. Of course, everybody's looking at it because everybody's into Bitcoin. But as I've had a lot of experience with the healthcare industry, I started to wonder, like many of you probably, does blockchain have a space or any usefulness within the healthcare industry or within healthcare IT? The first thing you need to know about that is what blockchain is. And essentially, blockchain is a public ledger where transactions are recorded and they're confirmed anonymously. So once the events are recorded between parties and entered, they can't be altered. And what you're talking about there is data integrity. That's data integrity. That's the integrity piece of the CIA triad: confidentiality, integrity, and availability. That's what blockchain is. Now, how that relates to healthcare, it's somewhat interesting. I mean, we're already talking about transactions in healthcare where one might request a record. Let's say I'm a doctor and I request a patient's records from somewhere else, from some other hospital, and that record is exchanged. That transaction can be noted on a ledger, and nobody can pretend like this person asked for it, not this person, et cetera, or at least locations wise. People could, doctors can give out their credentials. Unfortunately, you still have human error within it, but essentially, it's fairly secure that the information or the transaction itself can't be altered to act like the transaction didn't exist. Blockchain, it has its ups and its downs, but it certainly probably can help healthcare. If they look at some of the use cases or problems that they're having, one of them is counterfeit drugs. Right? 10 to 30% of drugs sold in developing countries are actually counterfeit. So if you could mark those drugs with the right markings and get those transaction ledgers, you could probably track the counterfeit drug. You could separate the counterfeit drugs easier from the real drugs, and help protect pharmaceutical companies even more so. And you kind of weed out some of the bad drugs or some of the counterfeit ones, because some of the counterfeit ones they work, but they aren't supposed to be sold. And that's a big deal because thousands of jobs are lost due to counterfeit drugs. Maybe not as much in the U.S., but in Europe, about 40,000 jobs are lost because manufacturers hire less people because the fake drugs are out there. So that's one aspect in which blockchain can probably help. Another is clinical trials, keeping track of all the data in clinical trials. Blockchain can help with that, because it'll provide proof of existence, for each and every single document and verify the authenticity of each document. And in order to add new data, you know what I'm saying, everybody has to agree that the new data that you're adding is valid and you're a valid person to add that data. So that's within blockchain's frame of work. Because if you really think about it, it would be providing, hash and all those things, unique codes, et cetera, et cetera. The problem with it, though, in patient data management is availability. With everything, you get that CIA triad again. Will using blockchain be a little bit more cumbersome or a little bit more complicated? And it changes the data ownership, who actually owns that data, that changes, because you're talking about going from centralized networks or like centrally distributed to networks that are holding information in multiple places. A little bit more peer-to-peer sharing. So those are some of the questions that the healthcare industry is going to be asking probably over the next year or two as it starts to think of different ideas. MIT has created a program called Enigma. They began to look into how blockchain can help data, period, but mainly Enigma focuses on a lot on healthcare. Quite a bit. the way it works, and there's a good article on it on I believe it's on healthcareIT.gov. And I would say it is a good article, but if you don't understand blockchain or you're not too familiar with it, then it is a bit of a convoluted article. So learn the terms and learn what they're talking about beforehand. And you're going to have to know a little bit more about healthcare IT also before just taking a look at it. But, the thing about it is there are many, many ways when we're talking about authenticating the integrity of data that blockchain can help. It's just a matter of having the right technology that doesn't make things convoluted for doctors, nurses, people who pull records, anything like that. Making it worth it. There has to be a balance between security and access. If you're 100% secure, nobody can access it. It's like building a house with no windows, no doors, no nothing. Like, it's great, the house is secure, but no one can live in it. If you're in, you're in, and you can't get out. And if you're out, and you can't get in. There's no flow of in and out, which is what you need. Transmit, receive. You need a flow of information in, you need a flow of information out. You need read, and you need write. And that's the problem with 100% security. But blockchain isn't that. Blockchain makes it easier to actually read and write information, share information amongst each other while at the same time being secure. This is a matter of implementing it. And, the healthcare industry isn't very fast to implement things. But as I was saying, although we got off topic, going and taking a look at Opal Enigma, which is the MIT's project. It's a very interesting project. I mean, Enigma provides cryptography. It's part of a larger initiative that MIT has called Opal East, meaning open algorithms for equity, accountability, security, and transparency. So you'll have to go to MIT's site and check that out. But what they're talking about with that is using two core cryptographic constructs at the same time on top of a peer-to-peer network. Basically secret sharing, if you will. Like LSSS, LSSS14, and multi-party computation, MPC. You have to go look that stuff up. But anyway, we're getting way too in the weeds. But basically, a lot of companies are working on using it. So that's a good thing. I would suggest learning about it ahead of time before the government and anybody else starts to impress upon the usage of blockchain and the IT sector. As far as protect, it would be improved HIPAA. The challenges that I see is different hospitals in different regions are further along in the security space for hospitals than others. So those are going to be some of the challenges. But if you want more information, go to healthit.gov and go to MIT's site and check out their project. And they'll give some additional information on how blockchain can help the healthcare industry. There was actually a good article on Forbes a little while back, I think, probably sometime early last year, kind of asking the same question I'm asking: what would be the space or purpose of blockchain in healthcare technology? So go check those things out. If you like, feel free to email me at secnetlab@gmail.com or just ask questions in the comments.